Skin cancer is the commonest form of cancer. There are many different types. Ultraviolet light causes malignant change in cells in the skin. If it affects one type of skin cell, it'll cause one type of cancer. If it causes damage to another, it'll cause yet another form of cancer. They vary in the way they present, and they vary in terms of their seriousness.
The most common by far are basal cell cancers. They affect people sometimes as early as in their 20s.
They tend to be locally malignant. If they become malignant, they don't spread typically to other parts of the body.
You typically get them around the face, the eyebrows, the hairline, around the nose. They can generally be removed easily.
People tend to get crops of them, so you can have people having lots of basal cell cancers removed, and it becomes quite a challenge actually to keep on top.
And then the squamous cell cancer. This is a form of cancer that arises from the keratin-forming layers of the skin.
Really common on the backs of the hands, the face, the chronically exposed sites. And they can become nasty, particularly if they're on areas of the head and neck and the lips and the ears.
The cells can gradually become more and more transformed, more cancer-like, and ultimately they can spread, typically through the lymph nodes. Still normally quite treatable as long as it's picked up in time. The third form is cancer of the pigment cells. They're called melanomas. They typically develop in freckles. If you keep subjecting those to chronic ultraviolet light, then gradually they can become malignant.
They can be quite thick and difficult to diagnose in some cases. They can develop slowly over many years, and they can sometimes erupt as more rapidly growing lesion.
It can spread locally to the local glands under your arm or in your groin or other places. And even more seriously, they can spread through the blood to pretty much anywhere in the body. And that's a very dangerous clinical situation and requires urgent treatment if it gets to that point. Just about every form of skin cancer is largely preventable, and it's the ultraviolet light, it's the exposure to sunlight that's most critical. Fortunately, most of them can be detected early, or even better, prevented, and if they're detected early, removed and really cause no other problems. It's very, very important to be vigilant, inspect your skin, have it attended to quickly so that cancer can be ruled out. And if it is a cancer, then if it's picked up very early, then the outcome, the prognosis is really generally very, very positive.